Most men don't realize that their penis ages just like their heart, their brain, or their bones. Ignore it, and you don't just lose function, you lose confidence, dignity, and connection. Hello, I'm Dr. Sophie Caldwell. I'm a urologist and specialist in men's health with over 30 years of experience, particularly in helping older men preserve not just their sexual function, but their sense of identity. What if I told you that the number one cause of penile dysfunction in men over 60 has nothing to do with age, and that it's not medication, but simple daily care that'll change everything? In this video, I'm going to share with you 5 essential ways to care for your penis that are backed by science and specifically designed for men over 60. These aren't just tips, they're habits that can genuinely transform your quality of life. Let's get straight into it. Point number 1, sexual activity keeps you healthy. Here's something most men don't hear enough. Staying sexually active as you age isn't just about pleasure, it's about health. I've sat across from countless men in their 60s, 70s, and 80s who've told me they've simply stopped trying because they thought their body had given up on them. But here's what I've learned after 3 decades in this field. Use it or lose it is more than just a saying. It's biology. When you remain sexually active, whether with a partner or through self-stimulation, you're keeping blood flowing to the penile tissue. That blood flow is absolutely critical. It oxygenates the tissue, keeps it elastic, and prevents the kind of scarring and shrinkage that happens when the area isn't regularly engaged. Think of it like any other muscle in your body. If you stop using it, it weakens. The penis is no different. Regular erections, even if they're not always perfect, help maintain the health of the erectile tissue. They prevent fibrosis, which is the buildup of scar tissue that can make future erections more difficult or even painful. I've seen men who stopped being sexually active for just a year or 2 experience significant changes that became much harder to reverse. But beyond the physical, there's something equally important, the psychological and emotional benefit. Intimacy, connection, and sexual expression are tied to your sense of self-worth, your confidence, and your vitality. When you remain sexually active, you're telling yourself that you still matter, that you're still present, that you're still a man with knowledge, experience, and value. I've watched men in their 70s reclaim their sexual health just by taking this first step. And often, once they do, other parts of their health begin to improve as well. It's a ripple effect. Confidence, intimacy, motivation, they're all connected. So don't let anyone tell you that sex isn't important after a certain age. It is. And it's never too late to start caring for this part of yourself again. Point number 2. Proper hygiene is non-negotiable. Now that you understand the importance of staying sexually active, let me show you something equally essential. It's something every man thinks he's got sorted, until it's too late. Let's talk about hygiene. I know this might sound obvious, but after 3 decades of treating men in my practice, I can tell you that proper penile hygiene is one of the most overlooked, yet absolutely critical forms of self-care, especially as we get older. I've seen far too many men come into my office with infections, irritation, or even more serious conditions, simply because no one ever taught them how to clean themselves properly. It's not about being dirty. It's about not knowing how aging changes your body and how to adjust your care accordingly. As we age, our skin becomes more sensitive, our immune response slows down, and the body isn't as quick to fight off bacteria or heal irritation. That means what was adequate hygiene in your 30s or 40s simply isn't enough now. If you're uncircumcised, this becomes even more important, because bacteria, sweat, and dead skin can accumulate beneath the foreskin, leading to infections like balanitis or conditions that increase your risk of penile cancer. Yes, cancer. And it's not rare. Poor hygiene is the number one cause of penile cancer in many regions, and that risk doesn't go away with age. It increases. But the solution is simple. Here's exactly what you need to do. Wash gently with lukewarm water and a mild unscented soap. Nothing harsh. If you have a foreskin, retract it. Wash thoroughly underneath, and most importantly, dry thoroughly. Moisture can be a breeding ground for bacteria, especially in the folds of skin. Always clean after sexual activity. Vaginal fluids, lubricants, or even just natural sweat and oils can disrupt the healthy balance of bacteria on your skin. This takes just 1 minute, but that small daily habit can save you from painful infections, odor, or something far more serious. What surprises many men is the emotional shift that comes with it. When you care for your penis the same way you care for your teeth, your heart, or your appearance, you begin to feel different about yourself. Cleaner, more confident, more in control. And that's powerful, especially in a world that often tells older men to step aside or give up on their bodies. But hygiene is just the beginning. There's something else you need to know, something most men never talk about, until it's already caused serious damage. And it all starts with what happens during intimacy, when you're not fully ready. Point number 3. Never rush penetration. Let me talk about a hidden danger that almost no one warns you about. It might surprise you, but it's something I've seen time and time again in my clinic. Men unknowingly injuring themselves during intimacy simply because they didn't realize the risks of having sex before being fully erect. This might seem like a minor detail, especially when desire and the moment are pushing you forward. But attempting penetration with a semi-erect penis can cause damage over time, and the consequences can be life-changing. Let me be clear, your penis isn't just a tube of skin. Inside, it's a delicate structure of blood vessels, spongy tissue, and smooth muscle. When it's not fully hard, it doesn't have the necessary support to withstand pressure. That's why forcing it to perform before it's ready can lead to what we call microtrauma, small internal injuries that might not cause immediate pain but gradually build up scar tissue beneath the surface. Over time, that scar tissue can harden and pull on surrounding tissue, leading to what's known as Peyronie's disease. If you've never heard of it, it's a condition that causes painful curvature of the penis, sometimes so severe that intercourse becomes difficult, or even impossible. I've sat with many older men who were far too embarrassed to mention the changes they'd noticed until it was too late for conservative treatment. And the truth is, most of them didn't even know this risk existed. They weren't careless. They were just unaware. So here's what I want to tell you now. Slow down. Your health, your comfort, and your confidence all depend on treating your body with patience and respect. Waiting until you're fully erect before intercourse isn't just safer, it's smarter. It protects you from long-term damage and ensures that sex remains pleasurable and pain-free. Here's exactly what to do. Use lubricant to reduce friction. Take your time with foreplay or stimulation. If you're feeling pressure to rush, talk to your partner. It's not worth the risk. And if you're using medications or assistive devices to help with erections, let them do their job fully before proceeding. This simple act of caution can save you years of discomfort and frustration. And it's not about being fragile, it's about being informed and empowered. Point number 4, limit pornography consumption. Now let me talk about something that requires real honesty. We live in a time when access to adult content is easier than ever, and for many older men, particularly those who might be alone, widowed, or feeling disconnected, it can seem like a harmless way to keep desire alive. But after working with thousands of patients over the years, I can tell you this. What often starts as occasional relief can slowly become a replacement for something far deeper and more satisfying. And it can rob you of the connection you deserve. The truth is, excessive pornography use rewires the way your brain responds to arousal. It often trains the mind to rely on a very specific type of stimulation, fast, visual, and solitary. Over time, this can lead to what we call desensitization, where real-life intimacy no longer triggers the same excitement. I've had men in their 60s and 70s tell me they're confused. They still have desire, but when they're with a partner, their body doesn't respond the way it used to. And they think something's broken inside them. But in many cases, it's not physical. It's psychological conditioning from overexposure to pornography. Even more than that, excessive pornography use can create feelings of shame, isolation, and low self-worth, especially when it becomes a private routine that replaces human closeness. You start questioning your manhood, your ability to connect, and your value in a relationship. That's a heavy burden, especially when you're already facing the emotional challenges that can come with aging. I'm not here to shame anyone. No judgment whatsoever. But I do encourage moderation. If possible, use it sparingly. Instead, focus on rebuilding your natural arousal pathways through memory, imagination, or real emotional intimacy. That might mean spending more time with foreplay, talking openly with a partner, or simply allowing yourself to feel without pressure or expectation. Desire doesn't die with age. It just needs a different kind of attention. Limiting pornography isn't about giving up pleasure. It's about reclaiming it in a healthier, more meaningful way. It's about bringing your body and mind back into harmony so you can experience true arousal, not just stimulation. Point 5. Your lifestyle is your foundation. Now, speaking of harmony, there's one final piece to this puzzle that ties everything together. It's the foundation that supports not just your sexual health, but your overall vitality. It's what powers your confidence, your performance, and your ability to fully enjoy life. Let's talk about lifestyle. If there's one truth I've learned after treating men over 60 for decades, it's this. The way you live your life shows up in your sexual health more than any prescription ever could. Many of my patients come in hoping for a magic pill, a quick fix to bring back what they feel they've lost. But the reality is, no medication can compete with the power of consistently healthy habits. Your lifestyle is the fuel that runs everything from your blood flow to your hormone levels to your mental sharpness. And yes, your ability to perform and feel like yourself again. The connection between lifestyle and sexual health isn't just anecdotal. It's biological. Erections depend on good blood flow, and blood flow depends on the health of your heart and blood vessels. When you smoke, drink heavily, or eat poorly, you're damaging those vessels and limiting circulation to the most important parts of your body, including your penis. Erectile dysfunction is often one of the first warning signs of heart disease, and it's your body's way of whispering that something deeper might be wrong. But here's the good news. Every healthy choice you make today has an immediate and lasting impact. When you stop smoking, your circulation improves within days. When you cut back on alcohol, your testosterone can begin to rebalance. When you start walking for 30 minutes a day or eating foods that support vascular health, like berries, leafy greens, and oily fish, you're not just extending your life, you're enriching it. Your energy returns. Your confidence builds. And gradually, function begins to follow. What I love most is watching a man realize that his body isn't broken. It's responsive. It's been waiting for him to show up again, to care for it the way it's cared for him for all these years. I've seen patients turn things around dramatically just by changing their daily routine. They sleep better. They laugh more. They reconnect with their partners and with life. And they stop relying on pills because they've built something stronger, a foundation. So before you reach for another prescription, reach for your walking shoes. Choose water over whiskey. Prioritize rest. Connect with others. Your body is listening to how you live, not just what you take. Final point. Sleep without underwear. Now, there's one last piece of advice I want to share with you. It's simple but surprisingly powerful, and most men have never heard of it. It happens whilst you sleep, and it could be the secret to preserving your manhood as you age. Let's talk about something unexpected. What you wear to bed, or rather what you don't wear. This might sound like such a small detail, almost too simple to matter, but over the years I've learned that it's often the quietest habits that have the most surprising impact. Sleeping without underwear is one of those habits, and once you understand why, it'll change how you think about both nighttime rest and long-term health. During sleep, your body enters a natural state of repair and regulation. For men, part of that process involves spontaneous erections that occur throughout the night. This is completely normal and actually necessary to keep the erectile tissue healthy and oxygenated. But when you wear tight or restrictive underwear, particularly briefs or snug-fitting sleepwear, you can unknowingly compress your penis during these nighttime erections. Over time, that pressure can lead to tissue irritation, reduced blood flow, and in some cases, the development of internal scarring. That scarring, especially when it goes unnoticed for years, can contribute to Peyronie's disease, the painful curvature of the penis that's far more common in older men than most people think. Simply sleeping naked or in loose-fitting boxers allows your body to function naturally without restriction. It reduces unnecessary pressure, improves airflow, and lets your tissue breathe. It's one of the easiest things you can do, and it costs you nothing. Many of my patients have told me they notice they feel more comfortable, sleep better, and even wake up with better morning function after making this small change. It's not magic, it's just good sense. Quick summary, your 5 essential steps. Right, let's bring this all together. Here are your 5 essential steps for maintaining penile health after 60. Number 1, stay sexually active. Use it or lose it is real. Keep blood flowing to the tissue through regular sexual activity, whether with a partner or alone. Number 2, practice proper hygiene daily. Wash with lukewarm water and mild soap. Dry thoroughly and always clean after sexual activity. This prevents infections and serious conditions. Number 3, never rush penetration. Always wait until you're fully erect before intercourse to avoid microtrauma and conditions like Peyronie's disease. Use lubricant and take your time. Number 4, limit pornography consumption. Excessive use can desensitize your brain to real intimacy. Focus on rebuilding natural arousal through connection and imagination. Number 5, prioritize a healthy lifestyle. Stop smoking, reduce alcohol, eat well, and exercise regularly. Your blood flow, hormones, and overall vitality depend on it. And don't forget, sleep without restrictive underwear to protect nighttime erections. These 5 steps aren't complicated, but they're powerful. They're about taking control, showing up for yourself, and treating your body with the respect it deserves. You're not too old. You're not broken. You just need the right information and the willingness to act on it. If you found this helpful, please subscribe to my channel for more advice on men's health. Leave your questions in the comments below, and I'll do my best to answer them. Share this video with someone who might benefit from it. And remember, your health is in your hands. Take care of it. Thank you for watching.